Hey
Hey guys,
guys,
we are
here
double
double
A
A team,
team. I'm Hannah.
and I'm Hui. Today we're gonna talk about a drug called Cimedtidine, the first generation of H2-receptor antagonist.
In 1970s, a peptide ulcer could be a life-threatening condition. Sufferers often endured periods of intense pain over many years, especially at mealtime and at night. Left untreated, an ulcer could result in severe bleeding and death. So, do you know what caused this condition?
Oh, I think the major cause is in the release of excess stomach acid, which leads to breaching in the lining of the intestinal tracts. Continuing acid secretion prevents healing. Patients have to rest and follow a bland diet. Surgery to remove a part of the stomach were a last resort.
That's right. So the chorus is very simple, but at this time the best medicine to treat this disease is natamide. It didn't work very well and have a serious side effect called agranulocystitis, a blood disorder which lowered white blood cell count. This side effect has been anticipated as a possibility because of the way this drug operates. Other group of drugs is called alkalis, which provide only temporary relief. And then, in 1976, a new choice of medicine is discovered. They named it histamine H2-receptor antagonist drugs. This discovery is started as an international historic chemical landmark of United States. Later on, they discovered it at the UK Library of Cimedtidine and French, and following research was Cimedtidine, the first drugs ever in this family. Cimedtidine was a first effective anti-ulcer drug in the market at this time. It profoundly decreases acid secretion, thus promoting healing and avoiding the need of surgery.
Oh, I know the first Cimedtidine brand name. It's called Tagamet in it. I think it a revolutionary impact on the treatment of the peptic ulcer. About 10 years after its introduction, I think it have actually sold up $1 billion and had become the world number one prescription drug for ulcer, the upper GI tract system. And it's still nowadays, I think.
Exactly. So now we move to the main topic. We're gonna take a close look at this fantastic drug called Cimedtidine. We need to make clear five sides of this medicine so we could help patients with this common disorder. Okay, so the first one is formulation. You can see in picture both cimetidine and histamine have imidazole ring. This is the reason why cimetidine competitively inhibits the action of histamine at the histamine H2 receptor. Cimetidine usually used as oral administration because also located in GI tract system. So I think using oral administration most effective. A little bit thing is cimetidine has a bitter taste and characteristic odor. So when we use cimetidine by oral administration, it can make you feel nausea. So be careful with this.
We move to the second one section. It is metabolism. As you know, Cimedtidine completely inhibits the action of histamine at the histamine H2-receptor of the parietal cells because of its structure. Besides, studies have shown that Cimedtidine inhibits daytime and nocturnal vasogastric acid circulation. It's amazing, right? It's like what you say in 1970s, we usually use antagonist to heal ulcer, and patients suffer a lot of pain. But when Cimedtidine was found, it can treat the cause, also relieve the symptoms.
Okay, so now we move to the next one. This section is very important. We will explain clearly as we can. Cimedtidine was indicated by five main indications. The first one is short-term treatment of active duodenal ulcer. Short-term treatment within 4 weeks, rarely used at full doses for longer than 6 to 8 weeks. So, do you know what a difference between gastric ulcer and duodenal ulcer? We need to compare different symptoms of two kinds of peptic ulcer. It will help you have that recommend with your patient.
A peptic ulcer is a sore sat on the inside of the stomach lining. A gastric ulcer on the upper part of the small intestine, a duodenal ulcer, and which is more common than the first one. One way of telling if you have a gastric ulcer or a duodenal ulcer is to figure it out where and when your symptoms occur. Times the pain occur may vary. The gastric ulcer patient feel hurt the most when they are eating, but one with duodenal ulcer is relieved by food intake, and the pain only occurs 2 or 3 hours after that, usually at night time. And people had duodenal ulcer is overweight, when who with gastric ulcer is usually thin and slim. Yeah, I think that's all I can think of right now.
The second one is maintenance therapy of duodenal ulcer patient at reduced doses after healing of active ulcer. Patients have been maintained on continued treatment with cimetidine 400 mg for periods of up to 5 years. The next is short-term treatment of active ulcer. There is no information concerning usefulness of treatment periods of longer than 8 weeks.
And 4. Erosive GERD. Erosive esophagitis is diagnosed by endoscopy. Treatment is indicated for 12 weeks for healing of lesion and control of symptoms. The use of Cimedtidine beyond that time has not been established. 5. The treatment of pathological hypersecretory condition. It is a really good drug, isn't it? But can we use it for every patient who have GI tract system disease?
No, we need to be careful in some situations. Like cimetidine is contraindication for patients known to have hypersensitivity to the product. It may cause dangerous situations, so be careful when you recommend to your patient.
Cimedtidine is so good in treatment, but it also have a few side effects and precautions too. Side effects include headaches, dizziness, somnolence, diarrhea, with treatment more than a month, gynecomastia. Precaution: administer oral drug with or before meal and at bedtime. Arrange for degree dose in case of hepatic or renal dysfunction to prevent serious toxicities. Its formulation, metabolism, indication, side effect, contraindication, precaution, so we could understand the drug and use it knowledge to advise our patients. And that brings us to the end. Hope the information is useful to you. I sincerely appreciate your attention and thank you for giving us your time.
Thank you guys. If you like this video, please like and subscribe our channel. Bye.